Greetings. My name is Khadija Howell. I am an assistant policy researcher and doctoral fellow from RAND Corporation, partnered with APLA Health in Los Angeles for this study. This study centers Black sexual minority men, their recent experiences with discrimination, and their thought process to answering the multiple discrimination scale that is used in APLA Health's Still Climate Initiative through a methodology called Think Aloud. So join me in the breakout room to learn more about these discriminatory experiences from their perspective and voices, along with how discrimination impacts not only their mental health due to stigma, but their life overall.
Hi, everyone. My name is Alia Ibn Idris. I'm a postdoctoral research fellow at the University of Cape Town in South Africa. My poster is titled Association of Combined Antiretroviral Therapy with Altered Brain Function and Cognition Dysfunction in People with HIV. I'm interested in brain function in general, specifically in people living with HIV, and I'm trying to see if there is an association with certain classes of therapy on brain function using resting state data and on cognitive function, looking at the neuropsychological test performance. If you would like to know more, come and join me in the breakout session.
Hi everybody, welcome to the 2022 CHIPS HIV Next Generation Conference. My name is Ricardo Mendoza Lepe. This poster is a collaboration between the Trans-Latina Coalition and Bienestar Human Services. The title is Desde su perspectiva, Inclusivity and Research Gaps in Transgender Research. To give you a brief overview, a research gap was formed with immigrant Latinx transgender women to learn about research development and seek feedback on a story-based intervention to improve health outcomes with this community. Please join us in our break room to learn about the topics we discuss and how this can help us build inclusivity and trust in this community. Thank you.
Hi everyone, my name is Amanda Miller and today I am here to talk to you about my research that I have undertaken in South Africa to better understand the relationship between alcohol use and intimate partner violence and PrEP care outcomes among pregnant and breastfeeding women at high risk of HIV in Cape Town, South Africa. This work was funded by a CHIPS pilot grant, and during my poster presentation, I will be talking about the methods as well as preliminary findings. We conducted 20 in-depth interviews with women who were currently or recently pregnant and reported alcohol use during pregnancy or experiences of intimate partner violence. We then asked women about these experiences and how they might have influenced their HIV prevention methods. So please drop on by if you have questions or you want to learn more. Thanks.
Good morning, everyone. My name is Brett Moulton, and I'm an epidemiologist with the Los Angeles County Department of Public Health. My poster is titled Ending the HIV Epidemic in Los Angeles County, HIV Diagnoses Among Clients Utilizing Free Mailed HIV Self-Test Kits. In this poster, I'll describe a new program intended to expand access to HIV testing and increase awareness of HIV status of underserved populations. This program is promoted through dating apps and allows eligible residents to order a free HIV self-test kit through the mail that can be used at home or in a private setting. I'll include information on who has participated in the program, their experience, and the impact of the program on identifying new HIV diagnoses among Los Angeles County residents. I look forward to discussing more about the experience of this program and answering any questions you may have. Thank you.
Hello, my name is Jada Williams, and my poster is titled Experiences of the COVID-19 Pandemic Among Queer Black Men in Los Angeles, Reflections from a Virtual Listening Session, which was a study done in conjunction with Black Emotional and Mental Health Collective, AIDS Project Los Angeles, UCLA Division of Population Behavioral Health, and the UCLA Department of Epidemiology. For this study, the Center for AIDS Research Health Disparities Core convened a virtual listening session with queer Black men living in Los Angeles to describe the meanings of a shared lived experience, as well as the situations, conditions, and contexts that are a part of the lived experience of participants. This current study was designed to better understand the experiences of queer Black men, including experiences associated with their sexual minority and race or racialized identities during the COVID-19 pandemic. I invite you to come stop by my breakout room if you want to learn more about this study.
Hello, my name is Jocelyn Lemus, and I am a second-year epidemiology MPH student at the UCLA Fielding School of Public Health and a graduate student researcher at the UCLA Semel Center for Community Health. My research focuses on barriers to PrEP initiation among at-risk adolescents ages 12 to 24, using data from an adolescents HIV medicines trial network study. Existing research has indicated that low PrEP uptake rates among adolescents is a result of a lack of awareness of PrEP in general and a lack of information on how to obtain PrEP. However, the results from my analysis show that the majority of study participants were already aware of PrEP and shed some light on other relevant and possibly overlooked PrEP barriers that these participants reported. I'd like to welcome everyone to my breakout room, and I look forward to discussing my results further. Thank you.
Good morning, my name is Rashmi Mukherjee and I am a graduate student at the Institute for Global Health at University College London. The title of my poster today is Qualitative Study of Intersectional Stigma of HIV and Other Marginalized Identities Among Women Living with HIV in India. This is a brief overview of my project. The purpose of the project was to understand how intersectional stigma shaped experiences of domestic violence for women living with HIV in India. I conducted semi-structured interviews with women living with HIV in Kolkata, India, as well as interviews with a diverse range of key informants. The results showed that intersectional stigma of HIV and domestic violence amplified stigma. Women with additional marginalized identities experienced worsened violence, which was temporal in nature. Intersectional stigma compromised reporting of violence. So please join me in the breakout room to have a look at my poster and talk more about my project. Thank you.
In this study, the research question is what is the everyday life personal, relational, and social experiences of HIV and AIDS amongst adolescent girls and young women aged 15 to 24 years in the context of patriarchal culture in Murray, Zimbabwe. This research adopted a multi-method participatory qualitative design. The participatory research methodology is a collaborative research conducted with participants rather than on participants. Therefore, two participatory research advisory committees were formed, one with the professionals supporting adolescent girls and young women and the other with adolescent girls and young women living with HIV and AIDS. 3 methods were used to generate data: online semi-structured interviews, photo voice, and focus group discussions. 5 overarching themes were generated from semi-structured interviews and photo voice, while the focus group discussions generated 6 overarching themes.
I am Antoine Matthews, Director of Youth Programs at Code Tenderloin, and today I am presenting about nonprofits developing program implementation to support the communities they serve through incentives and resources, thinking about the stakeholders that you may work with in the community that you may serve as well. Today I am presenting number 11. If you can join me in my presentation, that would be greatly appreciated, and I can't wait to meet some of you all in my presentation today. Thank you so much.
Hi, my name is Vanessa Wari, and this presentation is part of the JUST Research, Trans Futures and Health and Scientific Knowledge project, which seeks to articulate a justice-oriented perspective to not only conducting TGI relevant research, but also towards repairing existing relationships between academic research institutions and TGI community members. The aims of our study were to understand key differences in the research priorities of TGI communities and university-based researchers that do TGI-related research, as well as to learn from a community perspective where and in what ways our approach to ethics can be transformed. We conducted 15 semi-structured qualitative interviews with TGI-identified community-situated leaders and researchers. The analysis of these interviews are being used to help us develop a facilitator's guide for use in phase 2 of our study, which will seek to bring together TGI community members from Southern California together to explore these themes in greater detail. Upon reflection of our journey through this project, we identified several opportunities that we had to approach the research from a more humanistic mode of inquiry, and it's an honor to be able to share these with you today.